the end of it. Yes, thank you.
Bertrand, thank you for your wonderful talk. That has a great ELSI implication and reflections for our audience. Especially we know that in this hospital we have team working on the autism gene too, and we also have some child psychiatrists and geneticists visiting today. So we are now open for question and answer. And any comments? Questions?
Yes,
Just curious about the landscape of regulation in terms of these new genetic tests in France. Apparently, the interpretation of these genetic tests is very complicated. And surely I think parents need some gatekeepers to avoid confusions that you have warned against. So is there any regulation before a test gets on the market and can be provided by physicians as opposed to some of the home tests that initially was presented that are directly marketed to consumers?
Well, in France, the regulation is very restrictive. The DNA testing can only be done if ordered by a physician or by a judge. And for example, if I send my DNA to complete genomics for sequencing, I can incur a heavy fine and I think even 1 year in prison. I mean, which is somewhat ridiculous because it's impossible to enforce. But anyway, that's how it is. Now, in terms of approval for use by MDs, I mean that's a bit similar to FDA. It's CE, IVD approval, which is well, mostly dependent on the test being done in a reasonable environment, not on proven clinical utility. However, of course, we have like Taiwan, a national health system, and so the national health system is not going to pay for the test unless it has to be proven to have some utility. So I think, no, there is also demand, to a certain extent, demand from the parents and to a certain extent from the autism charities for genetic tests, but the situation is not as freewheeling as in the US. There was a question.
Yes, Kevin, first. So, I have two questions. The first is that you mentioned that the concordance rate between the monozygotic twins is pretty high. I'm wondering that if there is any kind of adoption studies into this, such that we can always rule out the social or the nurturing effect, because many monozygotic twins were raised together. So maybe that's one part that we should verify first. Okay, then after you answer the first question, I'll ask the second question.
Okay, so the first question is whether there are any adoption studies like twins a year apart would be ideal. As far as I know, no. I mean, these studies, it's not easy to find twins that have been reared apart. It's not easy to be sure that they have really been reared apart with no contact. And I know in the past, many of the studies on twins reared apart have been quite heavily criticized. However, I mean, the dizygotic twins, they are also raised together as the monozygotic twins. So unless the parents behave more similarly to the two members of the monozygotic twins than they do to the two members of the dizygotic twins, I mean, the difference in concordance more or less eliminates the role of the environment.
Yeah, I understand, but it still could not be ruled out that these multi-genetic scheme
and in fact, so the recent work I alluded to reduces well, quite significantly the concordance for monozygotic twins to I think 60%, and increases the concordance rate for dizygotic twins to something like 15%. So the difference is still there, but it's not as high as it used to be. And it's a paper that was published just a few months ago, I think in the Lancet. I'm not sure I remember. But and what the authors suggest is that there may be actually a shared environment during pregnancy, something happening during pregnancy, which increases the risk of autism, and that would then affect both dizygotic and monozygotic twins.
Okay, many thanks. And my second question is that, because according to your argument, it seems to me that it is inevitable for people to misunderstand what those genetic tests means. Because you said that there is a huge market waiting for these new genetic tests. I'm wondering that you want to regulate these genetic tests, but there might be two ways to approach to regulate. And the first one is that maybe you just say, okay, if you do not show your scientific validity, the government would ban the marketing of these genetic tests. That would be the first one. And the second one is that maybe some people are more market-oriented. They will say that we will allow you to sell those genetic tests, but we want to warn the people that this is not useful. Please pay attention to this. And then if there is nobody wanting to buy those genetic tests, then no company would do this. So which one would be the major focus? Educate people or to regulate these genetic tests? Which one?
Yeah, I mean, I think the only hope is education. But you can see that now when you buy cigarettes, you have smoking kills written large on the packet, and still people continue smoking. So and outlawing a test in the internet era doesn't make sense. I mean, paternity tests are also outlawed in France unless ordered by a judge. But of course, anybody can do it by sending a sample to England or whatever. And it's almost impossible to regulate that. So I think we have to try and make understand what this kind of test really means and what it cannot say, and hope eventually people understand that. Yes?
I have a question. I'm not sure how to frame it. When you presented the initial media release of the core gene test, you said that it's marketed in terms of it would allow for early diagnosis and hopeful treatment. And you use that language subsequently when you commented about other tests. But for a disease like autism, unless you fall back on your French heritage and say it's a psychoanalytic explanation, what are these interventions that are going to fix it? You see what I mean?
Yeah. I mean, the behavioral treatments, I mean, which try to stimulate the child in ways that are compatible with the peculiar features of autism. I mean, like a different use of visual clues and that sort of thing. They do have some positive results in terms of the child learning to speak, or the child being able to integrate into some environments. So I think these are the only currently worthwhile treatments. And
they have some results. My understanding is they're pretty mixed.
Yeah, they have limited results. They certainly don't cure autism. They improve the symptoms up to a point. And they're probably more effective than the earlier they are taken. course, the brain is very plastic. The first one.
Yeah, that's what I want to ask. Are they more effective the earlier they take? And you said that, and I just don't know this literature. Because it seems to me that it might be that if you do any intervention, some are going to do well with it, but it may be placebo effect. I mean, we just don't know. Unless there's controlled studies, it seems to me that we really have no good evidence. And I don't know the literature enough to know, are there?
Well, we have child psychiatrists and also
Yes,
psychiatrists.
I would
Can comment on this. Yeah. Kevin, you want to say something? Or Dr. Choi, please. My understanding is that now they have better intervention early, so the outcome is better.
Okay.
So an early diagnosis is certainly
That makes a difference. Okay, thank you.
I mean, there have been real double-blind studies on.
That's
I
okay.
mean, double-blind studies on the effectiveness of TEACH or ADA. I'm not aware of real double-blind studies on whether it's more effective when it's early, but maybe I actually only look at the studies that were quoted in a French report from the Ministry of Education of Health, which was published a couple of years back, so that there may be newer work. But there's something there. It's not a miracle cure by far, but it's definitely better than nothing.
Thank you.
I should let the expert have the word. 推他刚刚问的是说那个自闭症如果早期治疗，是不是真的有帮助？
Because early intervention through behavioral approach to communication, facilitations, that did work for many kids for their progress through, say, the contrast studies. Yes. So in our unit that we accept preschool children to have intensive interventions.
Yeah. JD, I would like to add something before we go on with the question. Maybe I've sounded too negative on research on the genetics of autism. I'm very negative on its current diagnostic validity, but I'm not saying that this research is worthless, because this research, I mean, it is solid in that the results from the GWAS studies are reproducible, they are found by other groups, they are statistically valid, and they may allow us to understand some of the pathways that are disturbed in this syndrome, and therefore eventually to find some kind of treatment. I think it's a really a worthwhile scientific topic. It's just wrong to at this time to think that it can lead to useful diagnostics.
First of all, thank you for a wonderful talk that provides the science and the social context in which this is happening. I want to express a concern and then ask a question. It seems to me that most disorders, especially if they're spectrum disorders or mixed bags, it's always genetics and the environment. But the science of the genetics is very exciting, and the business interest of the genetics is very lucrative. And so I think the environmental component gets underfunded or under-researched. So I guess my question is that the case with autism? Are there environmental links that would be worth researching that are sort of relatively neglected because they're not going to make the company a lot of money?
No, I agree with you. I mean that generally environmental research, research on the role of environment in these diseases is unpopular and yet important. I don't think there is much going on in the case of autism. We've had in the past examples of bad examples of environmental research. So of course the psychoanalytic view, but also the vaccine story, because there was a paper which was finally retracted after many years of discussions on linking a certain type of vaccination to autism, which turned out to have no scientific foundation after all, which actually generated a lot of excitement, and even now a lot of literature. You find dozens of books on Amazon explaining the link between vaccination and autism, and many people believe in that, and there's absolutely no scientific evidence. So I'm afraid this throws suspicion on the research on the role of environment, which of course is certainly important, and especially again environment during pregnancy. I mean, I used to believe that the so-called autism epidemic was just based on changes in diagnostic. But now I wonder if there might not be something environmental related to conditions during pregnancy, and maybe to pollution or whatever events, or drug use or whatever during pregnancy. I mean, it's continuing, the incidence is continuing to rise. Looks pretty strange.
So could I come back to Kevin's question about regulating genetic testing of not definite value? You refer to two models. One is the business model, and the other is the educational model. But I think we argue in our paper that there are some professional roles between these two models. Because this test normally usually used by doctor's prescription. But now we know that business company could make this commercial, make it DTC, and you can just give your sample to the company, they will give you the result. But if you got a result, if you get a result that shows positive or negative. But positive only means that it increased certain risk, and this risk is still not significant, unlike the test result in Huntington chorea positive disease. It maybe means that previously you had 1% in your lifetime, but now you are kind of a 1.5 or something like that. It may mean something, but it's still kind of remote. So we argue that maybe the professional body should advise, and for example, the Society of Genetic Testing or from Society from Psychiatry should advise their patient, or even advise the government, such kind of test should not be prescribed by commercial or by a pharmacist. It must be through the doctor's professional guideline to do that. So I think apart from business model and educational model, professional model might be a useful advice. So I'm not sure whether that applies in France or in Taiwan or the US. I think in the US probably there are more market-driven force to allow that to happen. But in Taiwan, maybe we should have some psychiatrists, whether when there are some company in Taiwan, maybe in what sense they want to sell this. It could happen in other kind of disease. They want to sell the BRCA genetic testing kits in the supermarket. So should surgeon or should psychiatrists come forward and advise, no, this should be banned?
Yeah, the psychiatrists are very happy that we have this kind of power to be the necessary learning medium to explain how the result is. But I agree that, but in that kind of situation, maybe conflicts of interest will be another topic that we have to deal with. Yes, maybe we would be buy off by the genetic companies. Yeah, that would be worry about that. Thank you.
Any other comments or questions?
Feedback for this question that I would like to take more the educational approach, because that if we do education appropriately to the parents they also have their associations. They can put more, say, proper information plans. Maybe that's better.
So go back to the patient's group.
Just a general observation about how complicated, on your general point about genetic testing is, I mean, you know that the testing for APOE gene, you know, is linked to Alzheimer's, but it's also linked to hyperlipidemia. And at least 5 or 6 years ago, and I don't know what the current standards are, the American Society for Genetics and a couple of other societies argued that that test should not be administered for hyperlipidemia for diagnostic because the association with Alzheimer's, because they worry about people discovering that they might have that. But that's really, it seems to be extremely controversial for the simple reason that somebody who is at risk for hyperlipidemia wants that genetic test, and the thought might be expressed like this: well, I'd rather know if I'm at higher risk for heart disease because I can die long before I may develop Alzheimer's. So I mean, I think, you know, we have to be careful about how we regulate, because a lot of times regulators themselves impose values. Alzheimer's is a terrible disease that we ought not to disclose to people that they have a higher risk for. But that's a very paternalistic judgment.
But do you know about that relevant bag test?
No, I think about this topic, we have one question, which is education of MDs and the time they spend with the patients. And maybe a partial answer is having more genetic counselors who don't need to be MDs, but who can spend the time to discuss these issues with the patients. It takes time for things to be understood. And also, I mean, the more general issue of probability, how people interpret probability. If I mean, a high risk is not a certainty, and a low risk does not mean you are immune, and that's very difficult to get across. And yet, I mean, the probability only means something at the level of a group. It doesn't mean anything solid for an individual. And actually, there was an investigation of DTC companies by an office of the Congress, where they ordered tests from several companies and tested the same DNA with different personal histories from the different companies, and got conflicting results, and they exposed that really much of what these companies do is completely unreliable. But even that body from the Congress, the office of something, they showed that they didn't understand probability, because they said this company's tests say that I am a low risk for, well, that this person is at low risk for heart disease, yet he's wearing a pacemaker. So they thought that low probability meant that you were immune for the disease. But I mean, I can be a non-smoker and be affected with lung cancer, or I can be a smoker and live happily to 100 without any lung problem. So that's also a matter of education, but it's pretty hard to get across.
Jeff, do you remember the guideline for dementia genetic testing?
Yeah.
When that come to this case, when you do this test, it tell you about the risk of heart disease, and at the same time review the dementia. Do you remember any restriction on that kind of testing?
You mean the
No, dementia. Because George asked about ApoE review both dementia and also the heart disease part come to the dementia. We have just reviewed the guideline for genetic testing for dementia. But I think in general the principle is that this test will not be forbidden. But when before you do that, you need to explain very clearly the implication those refer to heart disease as well as dementia. Okay? And then you want to know about heart disease,
But when you do that, the test result is available, you inevitably must face the consequences of the condition. But if you want to know both, okay, he has proficient, I mean adequate genetic counseling before testing, I think the test will be allowed to do.
I think based on the counseling process, the counseling process is very important before you do the test. There are many criteria you have to meet. So probably the counseling process, even when the disease will happen or the actually happen, the incidence rate, there may be a considering point. So depends case by case, not percent of the case.
Okay. Do we have other comments or questions?
I have a comment based on my discussion with my colleague Junji, is that it partly probably echoes what Jim was saying, that because for a test to be ethical and beneficial, treatment or intervention has to be available in order for that test to be ethical. I think the problem for autism perhaps is that the infrastructure for treatment in some country or society may not be that widespread or accessible. For instance, children may have to line up for months before they can get effective intervention. And in these societies, if you have a genetic test available, the testing would be unethical, because even if the test is sensitive and specific, still they don't get any treatment. So my comment or argument would be, before we invest in a lot of these genetic testing, for perhaps what is more practical is to upgrade and make our the infrastructure for treatment and more available. And if treatment, that is the professional for treatment, including the psychiatrics or workers for child care, is more capable, then perhaps genetic testing may not be that useful, because we would have many professionals there to help us diagnose these syndromes earlier compared to genetic testing. Because my guess is that perhaps the diagnosis for autism may not be that complicated if parents are educated to watch for certain syndromes and then to get, if the availability of professionals are higher, then perhaps genetic testing may not be that crucial. That's my comment or my suggestion for policymakers compared to genetic testing.
I'd like to react to that, because I had a discussion with the CEO of Integragen, this spring. I wanted to visit them again before sending my book to the printer. And so, of course, he's defending his test. And what he says is that there are very few really capable clinical geneticists or clinical psychiatrists who have seen enough autistic children to be able to make a diagnosis. And so he defends his genetic test by saying that a positive result doesn't mean that the child will be autistic, but it means that this child should be put on the fast track to see one of the best specialists. And so he argues that the risk of not doing the test is to delay diagnosis and therefore make intervention more difficult. So it makes sense, but
yeah.
So this test is based on resources allocation reasons
yeah.
to